Hey friends, welcome to the October episode of Health Equity Mondays. You are joined today by Omari and Jasmine, and today we're going to discuss financial disparities in healthcare costs between men and women, as well as the school to prison pipeline.
Hey, welcome to Health Equity Mondays, hosted by Jasmine Leonard
And Omari Richards. Here we'll talk about all things health equity, public health, and culture.
Let's do our part to move health equity forward and all that jazz.
Before we check in, we want to recognize the genocide that is happening. As Black people and Black people working towards health equity, we understand that all of our struggles are inextricably linked, and thus we stand with the oppressed people of Palestine. Free Palestine. Our thoughts and prayers are with the people of Palestine, and I will pass it on to you, Jasmine, to check in. How are you doing?
Well, it has been an interesting month. For people who know me, October is not my favorite month, but it is a month that I am in classes and I am working and I am very busy. So I've been tired and I miss the sun. So
you miss the sun?
I miss the sun. It is going away so soon.
Fair enough. Fair enough. So it's all relative. I lived in Alaska, so it's a whole different missing the sun across there. But yes, the sun has been sneaking away from us a lot earlier than we'd like it to.
Yes, it has. And so I have to use my happy light a lot more, which is fun. But yeah, that's how I've been doing. Not that bad, but not that good either. So right in the middle. I've been coasting, I guess.
Well, coasting is solid. It seems like you're moving forward. Hope that we're up on the upper side of the coasting. I guess maybe going downhill on the coasting, but going downhill meaning that it's getting better, not that it's getting worse. But yeah, and as well as if you want to link that light so people can check that out, definitely put it in the description, because I know I've been talking to quite a few people who say that they have seasonal affective disorder, or they just feel a certain way when the sun goes away. So maybe that can be helpful and useful for other people out there as well.
Yeah. How have you been?
I've also been coasting. I would say this last couple weeks has been very interesting. I feel like I've gotten through and done a lot of the things that I wanted to do on the back end of the public health millennial, but then at the same point in time, I haven't put out one of my public health chats in 2 weeks, and that's probably due to me procrastinating as well as wanting to put out something that's a little bit new in how I'm doing this. And you all will see this if you'll subscribe to the podcast. Just keep on subscribing, and as I drop that next episode that should come out next week Friday, you'll see that the content, and it's just going to be a little deeper than it was before. But I say all that to say that I'm doing pretty fine, a little bit tired. I don't know if this is on the beginning end of burnout or whatnot, but I feel like I've been working very hard, a lot of longer hours, not as much sleep as I'm used to, but just trying to make it through, get these things done, create content, all the things, live life, etc., etc. But yeah, so I'm doing okay. I'll be heading to Costa Rica and Nicaragua next month. If anybody has recommendations, please feel free to message me. You can message me at the PH Millennial on Instagram. I am going to Nicaragua by myself. Ask me if I speak Spanish. I do not. So we'll see how that goes. But I'm looking forward to it regardless. I'm actually going to be taking a bus from Costa Rica to Nicaragua, which I'm very excited about. And also,
Oh wow.
yeah, we'll see. I haven't booked the buses yet, but I know there are buses that do that trip. So
Okay, so we're just going to hope that someone understands you. Do you even speak Spanglish or nothing at all?
I've been doing Duolingo for a little bit over the last couple of weeks. I don't know if the progress has been something that's sustainable to have actual conversation with someone, but I feel like I'm a pretty chill looking guy. People are gonna want to help me out.
Oh, this is going to be so fun to hear about when you get back.
Yeah, I'm looking forward to it, and I guess looking forward to share more with you all about the trip, and yeah, so looking forward to it.
All right. So we're talking this week or this month about financial disparities in healthcare costs between men and women. This sounds really boring, but it's actually very interesting, and I hope you all are listening. So a recent Deloitte study found that women on average pay $15.4 billion more, billion with a B, more than men in out-of-pocket healthcare expenses. While you might think that that's all linked to childbirth, when they take childbirth expenditures out, women still pay 18% more on annual healthcare costs when compared to men. Now, we have to note that this study looked at employed women and men, and due to the limitations of claims data, women and female, men and male is used interchangeably. So we don't have data on intersex or transgender individuals. Additional key findings from the study include that women seek more healthcare and treatment than men, which I think we've kind of known, but that results in 10% more in total healthcare expenditures relative to men. But however, this doesn't explain why women are paying more per their expenditures in healthcare. Men are twice as likely to wait more than 2 years between medical visits, and when they do seek care, 46% of men have less than $1,000 in claims. Women in general have healthcare costs that exceed their deductible, leading to increased out-of-pocket payments. I know I'm talking a lot of insurance. I'm going to break this down, okay? I promise. One more before I break it down. So the actuarial value of benefits is lower for women when compared to men in aggregate. The actuarial value is the ratio of average coverage provided by the insurance carrier for the population. For example, if the actuarial value is 80%, then a person who has a total amount of health claims of $1,000 in a year would on average have out-of-pocket expenditures of $200. So you would do the $1,000 multiplied by 100% minus 80%. Okay? So when they looked at this, they found that the benefits were consistently lower for women across all age groups except between the ages of 30 to 51, which they speculate is because it's the end of childbearing, it's perimenopause and menopause years. So in summary, women pay more dollars out of pocket than men and tend to get less coverage for every premium dollar spent. Women are paying more, but the value of the healthcare that they're getting is less.
That's crazy.
Right?
That's
Another
like
thing that they found. Go ahead.
it's like mind-boggling how much more it is, especially considering that men are more like, I don't know, is it term risk averse, or is it the opposite of risk averse? They're less likely. Like for example, myself, my shins have been hurting, but I'm putting that off because I'm like, it's gonna get better soon. But I know that's not the case for many women out there. Like if something's up, they go into the doctor. Men have this kind of, I don't know, we want to be quote unquote manly and be like, oh no, it's not that big of a deal, when many times it might be. So it's interesting. So yeah, you can continue. This is just fascinating.
Yes. So the last thing that the study from Deloitte found was that employers may be able to close the $1.34 billion with a B dollar actuarial value gap by enhancing benefit designs and creating financial equity in healthcare benefits. They estimate that this would only cost $12 per employee per year. $12 per person per year. That's nothing. That is nothing.
Right.
So you're probably wondering, why are we talking about this on Health Equity Mondays? It's a lot of insurance. And yes, I do work for an insurer, so I speak this language very well. If you have questions, you can message me at Health Equity Jazz on Instagram. When you combine this information with the ongoing gender-based disparities in employee wages, which are still hovering at about 82 cents on the dollar for white women, 70 cents on the dollar for Black women, and 65 cents for Latinx women, women are paying more for healthcare services than their male counterparts, but making less money. So while claims data is very limited, we can expect, if we were to layer on intersectional identities, that the disparities would be even higher. So just imagine this for Black women, Latinx women, Asian women, like It's ridiculous. So women are very likely making choices between the care that they need and what they can afford, thus widening health gaps, disparities, and issues in health inequities. I know this is very jargony in insurance, but the takeaway here is that women are spending more money for healthcare and the value of that healthcare is less. I think this is very interesting. This is very frustrating because healthcare should not be subject to the pink tax. It makes no sense. It makes no sense.
It really doesn't make much sense at all. And I'm fascinated into like why this is the way that it is and why have the insurers and the models that they make and the benefit designs that are out there just so disproportionately affecting women that it is really mind-blowing.
Yeah, if I had to guess, I would think that it's because, and this is some of the behind the scenes of insurance, they like to think about everybody just being the same. And so when you think about it, clearly men and women are not the same, that there are different expenditures, there are different services, there are different ways in which they embark with healthcare. It's the same when you think about peds and adults. A lot of insurance thoughts are that peds are just small adults, and that's not the case. Everyone has different patterns, everyone has different needs, and then thus you need to make the benefits reflect those individual needs and those individual patterns. But when you have a one size fits all approach, this is the issue that you get.
Yeah, absolutely. And as you're saying this, I need to schedule my appointment for my annual checkup for my physician. So I will do that. You reminded me to do that. So, but
Please
yes,
do.
we'll do. But this is startling, and I definitely think I'm glad that you brought this up, and because I don't think I've seen this anywhere else being a part of the conversation that women are paying more for less services than men are. But it's an important thing to think about, as well as it's something that we need to adjust and improve on so that we can create solutions that actually support everyone.
Yes. Now it's time for our promotional break. So for me, if you follow my newsletter, you haven't received one in a while. That's because, like I said, I've been coasting, and so writing a newsletter has felt like a chore, but I'm starting to feel better. Sign up for my newsletter. I will be recapping the first term because I am done with one term, on to the next. And
Term of what?
term of school.
I don't know what school you going to. Someone might listen to this and this might be their first episode. They got no clue what you're doing.
That's right. All right. So my newsletter is all about, it's called Becoming Dr. Health Equity Jazz, and it's all about my journey in completing a doctorate in public health at Johns Hopkins University. So I am in my second year, which is wild to be saying, but I'm in my second year, second term, and I recap how it's going. I recap my classes and things that I have likely caused trouble in because that's just who I am. So I will be back with my newsletter next month. So sign up now. You can find information on Instagram at Health Equity Jazz or my website, healthequityjazz.com.
Thank you, Jasmine. And I just wanted the people to be clear that you're doing some dope stuff out there, and let them know what you're doing. So I appreciate you sharing that, and definitely check out the newsletter as if you have not as yet. And on my side as well, I have not put out a newsletter in a couple of weeks alongside the public health chat. I have not put that out in a couple of weeks, but that will be back. Be sure to subscribe. All the links are below. And definitely join the email blast. That's probably where you're going to get the most amount of insights on the things that I share before it goes out on anywhere on social media, especially going forward, trying to build out a new content template for myself. So you'll see it as it comes out. So subscribe below. Thank you. Thank you. What is less exciting, though, is the school to prison pipeline. And this was a topic that, as I was researching it, I got very sad. Many times I got like tears in my eyes, like felt real emotions, because a lot of this is just very. It's like the systems have been set up to put a lot of Black people, Latinx people, disabled people into the criminal justice system. And yeah, I'm glad that I feel like we're in a time now where things are moving forward, and this is becoming an issue that people are trying to solve, but there's still a lot to do, especially when we think about systems and institutions and how do we get those to all align and have the policies that are supportive and trauma informed. But I digress. I just want to say this is a very deep topic with a lot of different perspectives, a lot of information that you can go out there and research and learn for yourself. So I'm going to try my best in the short amount of time that I was able to research this to really cover some of the main points I think that are important for you all to know, especially around health equity and what can be done moving forward. So what is it? The school to prison pipeline refers to the policies and practices that push school children out of classrooms and into the juvenile criminal justice system. It is characterized by strong police presence, harsh disciplinary practices, and punishment outside of a classroom setting. The pipeline reflects the prioritization of incarceration over education, taking kids out of the learning and putting them into a criminal justice system. Why is this a Health Equity Monday topic? According to the American Civil Liberties Union, school disciplinary policies disproportionately impact Black students. Black students make up around 16% of public school enrollment, but 42% of multiple suspensions. And for context, 51% of public school students were white and represented just 31% of multiple suspensions. Black students represented 31% of school-related arrests. They are suspended and expelled 3 times more than white students. Students suspended or expelled for a discretionary violation are nearly 3 times more likely to be in contact with the juvenile justice system in the following year. So just to give you a little bit of context about how we got here, and I might get some of these things wrong, but once again, a lot of information online that you can research and understand, and maybe like share more with me if you are able to dig in more or you understand these issues a little better than that I do. So in the 1970s, fewer than 4% of students were suspended. Fewer than
That was the time.
4% of students were suspended.
We need
That's
to figure out
crazy.
why.
That's crazy to me.
I mean, were students just better? Were they just better people? What is going on?
Well, I will dig into a lot, some of the things that I think kind of explain what's happening, and then you can give some thoughts about what you think about what I say, and then we can go from there.
Okay.
So, as the growing concern for crime and violence increased, schools shifted to zero tolerance policies. In 1994, the Gun Free Schools Act passed, mandating a year-long out-of-school suspension for any student caught bringing a weapon to school. This spurred broader use of zero tolerance policies against weapons and against bad behavior, essentially. However, when we think about weapons, some schools were interpreting weapons in startling ways. For example, making a gun with your finger was considered a weapon. Chewing a Pop Tart in a gun shape was considered a weapon. Bringing a camp fork for Cub Scouts to the classroom was considered a weapon. And in all these cases, there have been people who have been punished because of these things. In parallel to this, schools adopted their own version of the broken windows theory of policing. This emphasizes the importance of cracking down on small offenses in order to make residents or students feel safer and discourage more serious crimes. In schools, it translated into more suspensions for offenses that previously hadn't warranted them. Talking back to teachers, skipping class, being otherwise disobedient or disruptive. Interestingly to me, not wearing the school dress code properly. And sometimes this was interpreted as when a Black girl had braids or was rocking her afro. And in parallel with this, once again, schools started to more heavily use school resource officers or SROs. From 1997 to 2007, the number of SROs increased by nearly a third. They were brought in to protect students, not police them. However, This led schools to overuse the SRO and juvenile courts to handle the discipline issues, which gave birth to the prominence of the school to prison pipeline. A report from the Justice Policy Institute found that even controlling for schools' district's poverty level, schools with officers had 5 times as many arrests for quote unquote disorderly conduct as schools without them. By the 2017-2018 school year, there were more than 2.6 million in-school suspensions, 1.6 million out-of-school suspensions, 200,000 referrals to law enforcement, and just over 500,000 school-related arrests. Once a child touches the juvenile justice system, they are 67% more likely to end up in jail again before the age of 25. And just to highlight another inequity, in 2016, 99% of students handcuffed in schools by the NYPD were Black or Latinx. I know this is a long time ago, but it just goes to highlight the disproportionate inequities that are happening. And I'll pause here because that was my definition and the history of things. Do you think that covers what has really happened, Jasmine?
Yes. I mean, but the interesting thing is that I was working in a classroom last year in school, and we actually had to do a case study with the students and discuss what is something that they wanted to change. And they wanted to change their uniforms because they were freshmen and felt that their uniforms made them stand out in school and that they just didn't like the color of them. So we dove into the conversation with them and figured out that actually it made them feel kind of siloed, and it made them feel that they were being held to different standards than the rest of the school. So the older kids in school. And looking through that, we found out that they're not supposed to be suspended or get in trouble for not wearing their dress code. So it's interesting that these schools are not following the guidelines that they actually set themselves that are supposed to be helping the students, because we had stories of students that were being sent to in-school suspension, or being sent home because they weren't within their uniforms or they weren't within their dress code. Just from that experience, I say yes, I can see some of this as being the issues. I definitely have read the accounts of students who have been suspended for their hair, especially students that have locks or students that wear braids and things like that. So it's frustrating, but I think you hit it. I think you got all the points that have led to this issue now, and it's unfortunate.
It is very unfortunate. And I think one other overlay that I didn't get to dig into is the funding of public schools and how that has potentially decreased over the years. And then the administrative burden of having to handle disciplinary actions has really been pushed off onto these SRO officers, onto the juvenile justice system. And it doesn't do well for anyone. Like, someone's coming into school, they're acting out probably because of trauma, probably because of things not going well at home, and then you create an environment where they're out of the school. And one of the things I'll talk about in a little bit is like the exclusionary discipline, which refers to suspension or expulsion, which is really meant to take those disruptive students out of the classroom so that the other students can really learn. And what they learned in this study that I'll share in a little bit is that that is not the case. It just perpetuates the issue of like the lack of academic attainment throughout the entire classroom. Just to give a couple other statistics that I didn't get it right in here, but I thought were quite fascinating. And this is by the American Bar Association. There are 1.7 million students in school with police, but no counselors. There are 3 million students in school with police, but no nurses. There are 6 million students in school with police, but no school psychologists. There are 10 million students in schools with police, but no social workers. And it really goes to show how the system is not thinking about what are the needs that these students need. How can we really meet them where they're at? They're just like, you're acting out, go across there and get disciplined, go into the juvenile justice system, which adds even more trauma into their lives. But I digress. Talking about exclusionary discipline refers to the disciplinary action like suspension or expulsion that removes a student from their typical education setting. And they do this to help the other students be focused and ready to work. In a recent study asking the question, does anyone benefit from exclusionary discipline? The results showed that students who received a suspension for a minor infraction were more likely to have poor academic achievement. In classrooms where suspensions for minor infractions were used more frequently, students had lower academic achievement. These results add to a growing body of school discipline literature that advocates for replacing exclusionary discipline with more developmentally responsive policies and practices. In another study I read titled The Discipline Gap in Context, the Role of School, Racial, and Ethnic Diversity, and Within School Positionality on Out of School Suspensions. And what they learned here is that, consistent with prior research, we found that Black students were disproportionately suspended more often for more days and more likely for soft offenses. We also found that students in majority Black schools had the highest unadjusted rates of suspension. However, when controlling for multiple other student and school level characteristics, including overall suspension rates, we found that Black students attending majority white schools had a higher adjusted risk of suspension than in a majority Black or heterogeneous diverse schools, suggesting higher rates of differential treatment in white majority schools. And one other thing that the National Education Association shared around exclusionary discipline is that it led to worse academic performance, lower levels of school engagement, greater chance of leaving school before graduating, increasing likelihood of future involvement in criminal justice, as well as higher levels of school violence and antisocial behavior. Because it really does not help anyone to be in an exclusionary disciplined environment.
No, this is
It's
this is
disheartening.
sad.
I had to stop so many times when I was researching this because it really is startling that this is where we're at. And thankfully, a lot of the data that is around this is like data that's from 2017, 2019, except for the more recent studies that I read off just now. I would imagine that a lot of data has been hard to capture over the COVID period, and we would probably get new data coming maybe this year or next year to really see where things stand. And I think COVID has also taught us, hopefully, knock on wood, that we need to really ensure that we're taking care of the whole child and having a whole school framework to really approach schooling and improve like restorative practices. And just to get into that a little bit, so what can really be done? I think the first thing that needs to be done is like empathy and understanding is the first thing. Understanding that many students, especially impoverished students, are coming to school with trauma. They may not have gotten dinner or breakfast. They were abused and told to shut up at home. And this might be the only space that they're able to really express themselves. We need to really understand that we need to have restorative practices in schools, to have trauma informed institutions. We need a change in the zero tolerance policies in classrooms and getting to the root of the issue. The acting up in school is not the issue. There are many other socially determinants of health and other life needs that are not being met that cause students to act out in the ways that they act out. And until we are able to meet those students where they're at and address those needs, a lot of these things are not going to be improved. And one of the things that I've seen a lot more, and in some of the work that I do in my 9 to 5, is that when schools are approaching this whole child, whole school framework, they are really trying to not only equip the administrators and the teachers with like methods and tools to support students, they're equipping students with self-awareness and tools to support their own social emotional learning. And many places you'll see calm zones or classrooms that are dedicated to people or students that are amped up, and give them space and tools to really like understand that, okay, I'm amped up, and then give them space to understand, okay, why am I amped up? What can I do to like really make myself feel more calm and safe at this moment? So I just thought that was really cool. And if you don't mind, I know I've been talking for a bit, but I got one more thing that I want to share. So I pulled this graphic from a document from Minnesota where they're trying to replace exclusionary discipline in schools and really have a reparative type of system. And it really just walks through a case study of like a tale of two schools. One school where there's zero tolerance education system, and another school where there's restorative practices based on education systems. So they go through the path of Carlos arrives at school. In the zero tolerance education system, he is greeted by metal detectors and a police sage. In the restorative practices, he is greeted by teachers and administrators who welcome him and his fellow students as they enter. When Carlos is late for his first period class, in the zero tolerance education system, his teachers scold him in front of the class. Carlos talks back and is given detention. In the restorative version, his teacher waits until after class to speak with Carlos to learn more and sets up a meeting with his school counselor. Carlos gets into a minor altercation in the cafeteria. In the zero tolerance perspective, a school police officer detains and arrests both students. In the restorative perspective, a student peer mediator and support staff intervene, have the students sit down together and de-escalate the situation. And then lastly, later that afternoon, in the zero tolerance education system, Carlos is held in a juvenile detention facility all afternoon, missing school. He now has an arrest record and is facing suspension. In the restorative practice-based education system, Carlos and the other student agree to help clean the cafeteria during a free period. Carlos meets with his counselor and parents after school to help resolve the conflict at home. So I think this was a really great example of how those different systems can really impact how a student is seen and how they're interacting and how you're really addressing what are the root causes here and not getting someone into more trouble than they need to be.
Yeah. Did you go to a zero tolerance school?
I didn't go to high school in the US. So all of this is like very, very new to me in a sense.
Yeah.
Granted, granted, I did get beat by like with sticks and stuff, like corporal punishment, but that's neither here nor there.
Well, that's another day for another topic.
Right.
I was a peer mediator in school, so I know the importance of it, and I remember being able to de-escalate situations. So it's interesting that I feel like school has changed a lot since I was in it. And granted, for middle school and high school, I went to a private school, so I think their positionality is a little bit different than most public schools. But yeah, in elementary school, I was a peer mediator, and we definitely didn't have zero tolerance. So it's interesting to see the difference that this has had, and it's unfortunate.
Yeah, it absolutely is. But I'm grateful that much of the research and the information that I'm getting and reading more nowadays is focused more on that restorative practice-based model. It's just about how long does that take to implement and how do we support people while they make that transition in those policies. So all in all, I think it's going more positively, and I continue to hope that it continues to go more positively.
Yeah.
Anyway, I know you all were waiting for this part of the show, the health equity in action. It's a stomper. It's a stomper. So we'll give Jasmine some time to collect her thoughts. And for people that might be joining for the first time, this is the section of the show where Jasmine or myself ask the other person a true or false question, and they have to answer it. And fun thing that you can do with this is you can take this question and ask it to your friends or ask it to your family or ask it to your colleagues or classmates. So definitely use this. This was an interesting one, something that I didn't know about. Are you ready, Jasmine?
I'm ready.
Okay, so this is in 2017 when looking at school-related arrest. And just giving you some context there. So we're going to talk about Hispanic or Latino or Latinx students versus students with disabilities, okay? So when looking at the population of schools, Hispanic and Latino students make up 27% of the population, while students with disabilities make up just under 16% of the population in schools. So the question, students with disabilities had a higher school-related arrest percentage than the Hispanic or Latino student counterparts. True or false?
True.
I guess it wasn't that much of a stomper, but yes, you are right. You're right. It is true. It is true. And this was quite startling, to be honest. It's not that much of a difference. It's 24.5% for students with disabilities and 23.2% for Hispanic or Latino students. And I will just share so that people have proof that Jasmine was right. So give me 1 second here.
the reason that I knew this one was true, not because I know the like statistics or anything like that. I'm not sitting here following in-school suspensions, but I know that there's been a lot of conversation around students with disabilities and how disproportionate the impact of having a disability in school is when it comes to suspension. And then the conversation around COVID and the mental health crises has just added to that. So
Yeah, and I would definitely recommend anyone who's interested in learning more about that, check out this document that is linked below. It should be like USA Facts. Black students more likely to be punished than white students is the title of it. But it is fascinating. I did not realize that students with disabilities experience so much exclusionary discipline or all of these different things. And when you look at some of the other data that's you can find here, like the amount of restraint that happens to students with disabilities as opposed to everyone else is off the charts. It is off the charts, and it's really, really fascinating.
I've definitely read about the instances of like students with autism, especially if they're in traditional schools, just how disproportionate the impact is in terms of restraint and suspension and expulsion, all of it. So we're
Yeah,
we're not a we're not a good system when it comes to students with disabilities.
correct. And I have the chart up right now, and we can see that it was 79% of students with disabilities were restrained, and that's compared to 28.6 Black, um, 15 Hispanic or Latino, and 48.2 white. And I think it goes back to the point that I was sharing before, just the lack or how many police officers there are in schools, but how the lack of psychologists and counselors and social workers and just lack of people who are trained and well equipped to handle these types of situations or just understanding of how to address a student with a disability.
Yeah.
So good job, Jasmine. I will give you the points. Maybe it was a little bit too easy, y'all, but I guess I'll be coming back in December with
Oh,
the health equity action question to wrap up the year.
yes, we're gonna have to tally it up to remember where we are right now.
That sounds like a
I
plan.
feel like we're tied.
We might be, we might not be. I don't know. I don't know. I don't know. But anyway, you all, it was a pleasure chatting with you all. I hope you all have a great rest of your October. Have a great November, and we will see you all in November. Free Palestine.
Peace.